If you've ever been frustrated with the cost of prescriptions, you've got to hear this. Had a patient who came in with tears in her eyes. She was paying $347 a month for her medications, and she needed that money to survive. And she said, I can't keep doing this. And I showed her one simple question to ask. And the next month, her bill was only $112 for the exact same prescriptions. So here's what happened. I'm Suzanne, founder of caregiverhaven.com and the Haven community, where we help seniors and caregivers with all their individual challenges. Whatever it is, we have the answers, we have the resources, whatever they need. The other thing is, I've been doing this for 25 years. I have helped seniors as a physician assistant and their families. I've also worked in the emergency medicine departments as well as urgent cares. I have also done internal medicine. So I've run the different aspects and specialties in medicine and have helped mostly seniors with geriatric care. Well, if this video is going to help you, then please subscribe to my channel. Please share this video with as many people as might need it and give it a thumbs up. And this allows YouTube to share it with more and more people. Okay, let's get started. January is the first and worst month for prescription costs. Your Medicare Part D deductible just reset to zero. I'm talking to seniors here. That deductible you finally meet in October, it's going to be gone. You're back to paying full retail prices for everything until you hit that threshold again. Most people are paying 3 to 4 times more than necessary for their medications. Not different brands either, not risky alternatives either. The exact same pills, same manufacturer, just wildly different prices depending on where you fill them and how you pay. Here's what most people don't know. Your neighborhood pharmacist doesn't set your medication prices. Companies called pharmacy benefit managers, they're called PBMs, and they control the prescription costs in America. The PBMs sit between your insurance company, the pharmacy, and you. And they decide which medications your insurance covers. They process the claims and they determine how much the pharmacies are going to get paid. Many PBMs are actually owned by the same insurance companies that you insure your health with. They're already you're already paying premiums to them. It's just that they operate under a different corporate name, so you don't know that they're out there. Why does this matter? Because these companies profit from keeping you confused about pricing. The more confusing the system, the less likely you are to shop around. And I'm going to show you how to shop around. Your insurance copay isn't always your best price. When you go in to get a prescription and you use your insurance, you may have a very high copay. Sometimes paying cash or not using your insurance costs significantly less. But here's where it gets tricky. When you use a discount card and you pay $15 instead of $75 as an insurance copay, you save money today. But that $15 does not count toward your annual deductible. So that annual deductible that you were hoping to hit in October or even June is not going to happen when you use the discount cards. That $75 copay would have helped you. So which option is better? It depends on how close you are to meeting your deductible and when you expect to meet it. If you're within a few $100s, those higher copays might actually save you money at year's end because you'll hit your deductible faster and your coverage kicks in fully. Okay? Why does this matter? Because nobody explains this math because they profit when you don't understand it. And again, it's not the pharmacy's fault. The pharmacists working behind the counter have no say in how to get these prices down. Now, there are 3 specific questions that you need to ask every pharmacist, and then they can help you. These questions force them to reveal the options the system doesn't automatically offer you, but they're in their computer and they know how to look them up. So here goes. Question number 1. What does this medication cost if I pay cash instead of using insurance? This opens up a completely different pricing structure. Write that number down. And question number 2. Do you have a discount program or a savings card that would make this cheaper than my current price? Many pharmacy chains run their own discount programs that compete with cards like GoodRx. Okay? They don't advertise these because insurance reimbursements pay them better, but they'll apply them if you ask directly. Question number 3. Is there a different dosage I could split to reduce the cost? This requires your doctor's approval first, but here's something most people don't know. A 10 milligram pill doesn't cost twice as much as a 5 milligram pill. Sometimes it costs the same or even less. So could you split that pill in half? Could you do it safely? Only your doctor can guide you on that. This is why I'm giving you the pharmacy low price compare sheet. It's a free bonus sheet that organizes everything in one simple tool. So you're not trying to remember what 3 different pharmacists told you over the phone. And yes, I want you to call 3 different pharmacies and ask these same 3 questions. The first pharmacy you should be calling is your preferred pharmacy. They should usually give you the best price with your copay. Okay, this sheet also has a space to compare these 3 pharmacies and track your insurance, what cash versus discount card prices are, and they calculate your deductible trade-offs. 1 week before you refill, before everything's going to be due to be refilled, you call these 3 pharmacies. A major chain like CVS or Walgreens, and a grocery store like Kroger or Publix, and then an independent pharmacy or your preferred pharmacy. Ask them these questions about each medication, saying you know the strength, you know the dosage, you know the frequency, you know how many pills or capsules you're going to need, and are they going to be cheaper if you get a 30-day supply or a 90-day supply? Now, you can speed this up by checking online with these discount cards at their websites, because they will tell you exactly, if you put in your zip code, what pharmacy near you has the cheapest prices. So you enter the medication name and all the other information in the zip code, and they're going to tell you. And these prices are legitimate, and they are honored at the counter when you present the card or the coupon code. And many pharmacies don't even ask you to bother with a coupon card. They know how much it's going to be. But remember that many of these discount card companies are owned by insurance companies, so they're going to make money either way. I've had pharmacists tell me that patient comes in and says, "Well, I'm going to use my discount card, and I'll show my insurance company who's boss." Not really, because your insurance company probably owns that discount card, and so they're going to get their money one way or the other. Either you're going to pay $15 for it, or you're going to copay $75 for it. They're going to get their money. So when you use the card instead of the insurance, they'll save on the insurance claim and all the paperwork that goes on it, but they'll still profit from the discount transaction. So ask your doctor about alternatives too. All right, ask them if you can split the pill. Ask them if you can get a 60-day or a 90-day, but you got to know ahead of time what's going to be the least expensive. New generic versions are always coming out on the market regularly. So you should always be checking and seeing if there is a new generic that's out, all right? Because they do the same thing. They just cost less. The other thing you need to know is that many of you are on combination drugs. What I mean by that is you may be taking a pill that's half a heart medicine, like a beta blocker, and the other half might be a diuretic. Okay. It usually has a name and then a dash and then initials after it. All right. Like HCl or something like that. All right. So you need to look at this. If you're having a combination drug, ask the doctor, ask your senior's doctor, or if you're the senior, ask your doctor if you should split these pills and get two generics for less cost than one combo pill, which is typically a brand name. Very important. Very important that you do this. All right. So also review your Medicare Part D plan annually during open enrollment. These plans change their formularies every year. This is why January is such a nightmare. So moving medications between coverage, you've got to know. You can't just sign up for Medicare in October and show up in January and go, uh-oh, something's wrong. You've got to look at these ahead of time whenever you sign up for a Medicare plan. You've got to look at your prescriptions. So I suggest you do this ahead of time and see what the cheapest way to go and get all your pills on generics if you can, splitting them, changing the supplies, the number of pills. Are they capsules? Capsules might be cheaper than pills. Pills might be cheaper than capsules. Who knows, right? One person I worked with discovered that their new plan cost them $800 more annually for their same medication. So she switched plans before open enrollment and she kept the money. Now, many people in January have made a big mistake and they want to backtrack. And what they need to do is they need to get a healthcare broker. A health broker is a professional who's been doing this for years, who knows Medicare inside and out. And they will have to find the loopholes that you need in order to switch your plan so you're not stuck with it for a year. Okay? The crushing weight of these medication expenses make many people feel so powerless, and you really don't have to. You have to watch these prices because they can change daily. Your plan won't change, but the prices can change daily. It depends on those PBMs and what they want to do with the prices. So every time you refill a product, guess what? You've got to go back in and you've got to ask those same 3 questions all over again. You've got to do your homework. There are many mail order companies that will give you your medications. Amazon, you want to check with them, that may price these things out lower, but you still have to ask your doctor how you can switch them. What's the cheapest price? And you may have to do this every month if you don't get those 90-day supplies. All right. So here's what you need to know before your next refill. Download this comparison sheet that I have for you. It's free. It's a bonus. Look at it. It's going to take 15 minutes to fill out. You're going to have it for the rest of the year. And then all you need to do after that is just ask these same 3 questions. All right. Get in to see your doctor, or if you're a caregiver, get in to see your senior's doctor and see how you're going to reduce the cost. Do not forget that you can also go directly to the pharmaceutical company that makes the pill and ask them, if it's a brand name, ask them for some financial relief and see if you can get it. If you have any questions, let me know. And this is how you're going to start saving money. And I'll tell you an interesting story. I had a husband and wife come in one day, and she was spending $758 a month on her medications. She was going to Walgreens because her husband went to Walgreens, but she was on a different plan. And her plan dictated that she needed to go across the street to CVS. She did not need to go to Walgreens. Once I convinced her of that and she walked across the street to CVS to get her medications, her bill dropped to $97 a month for all her prescriptions because she was going to her preferred pharmacy. So do your homework. Don't just do it for convenience. Do it because you want to save money. Take care. We'll talk soon. Bye-bye.